Hello, I'm Kate Kelly, Regional President for Minnesota for PNC Bank. We are so happy to be here. What you do in business and in life is a vital part of the ultimate outcome. PNC applauds the 2020 Business Manufacturing Excellent honorees for their many contributions to our local community and to our world. You are leading and making this a better place for all of us. Thank you.
Welcome to the Twin Cities Business Manufacturing Excellence Conversation Series. We're all pivoting and learning new ways, and we're really enjoying this opportunity to talk to our Manufacturing Excellence Awards honorees who are featured in the current issue of Twin Cities Business Magazine. I'm Allison Kaplan. I'm the Editor-in-Chief of Twin Cities Business, and on behalf of everyone at the magazine, thank you so much for spending your lunch hour with us today. This is the second in a 5-week series that will highlight recent achievements, strategies, responses to COVID-19, manufacturing innovations of all of our recipients. So lots of good takeaways from these conversations. If you missed the first one, you can find it on our website at tcbmag.com. Feel free for everybody who's joining us right now, and I know people are still logging in, to join the conversation. You can use the chat feature at the bottom of your screen and the Q&A to post questions, and we'll try to get to those throughout our quick conversation today. Before I introduce today's speaker, I want to briefly thank our sponsors, PNC Bank, ProStaff, and Ware Technology Services. Ware Technology Services. We couldn't do this event without you. I'd also like to thank our industry partners, Minnesota Precision Manufacturing Association and the Manufacturers Alliance, as well as our video production partner, Studio 120. And now I'd like to have Brad Roberts join me from outer space, as we do these days. Hi, Brad.
Hi, how are you, Allison?
Good. So Brad is the Division Vice President of Abbott, the Structural Heart Division. And Abbott is being recognized by TCB for Health Tech Breakthrough of 2020. Brad has been with Abbott, formerly St. Jude Medical, for 12 years. He began his career with St. Jude in the cardiovascular division as the Senior Director of Operations, supporting the manufacturing of high-volume interventional cardiology products. This role expanded over time to Vice President of Operations, supporting all products within interventional cardiology, cardiac surgery, and electrophysiology franchises across 11 global locations. Clearly, I would not be qualified for anything even relating to this. Following the acquisition of St. Jude Medical by Abbott in 2017, Brad became the Divisional Vice President of Operations and Supply Chain for the Structural Heart Business Unit. He supports products across 6 locations globally. And prior to joining Abbott and St. Jude Medical, Brad worked in the pharmaceutical industry and held various positions across several startups and established medical device organizations. Well qualified. Thanks for joining us today, Brad.
Oh, thanks for having me. Really a pleasure to be here.
Good. Well, can you start by just, kind of giving us the 101 for those of us who don't understand a whole lot about the manufacturing of heart valves? Tell us a little bit about what you do, and in particular, the pediatric heart valves that you have really innovated and led the market on.
Yeah, I'd be happy to. I'll start by just describing a bit about who we are as a company. So Abbott is a global healthcare company, and we really focus on life-changing technologies to help people live fuller, healthier lives. Abbott's a global company with footprint in nutrition, diagnostics, medicines, and medical devices. Our medical device business unit or division focuses on addressing some of the world's most prevalent and costly and difficult to manage chronic conditions, including heart disease, diabetes, chronic pain, and movement disorders. My division, the structural heart division, is one of the newer divisions within Abbott. We're just over 4 years old. While we leverage Abbott's global footprint, our sole focus is on meeting the needs of patients suffering from structural heart disease. The solutions we bring to clinicians and patients encompass two basic areas. The first is our occluder-based technology, which is used to treat congenital heart defects as well as stroke prevention, and then valvular solutions for treating valve disease in aortic, mitral, and tricuspid valve space. Our therapies are life-saving for many people because they offer a renewed chance at life when there are no other options. And this applies particularly to our pediatric products that you described, Allison. So we've invested to develop pediatric devices to offer life-saving advancements in the treatment of vulnerable infants and children who might otherwise not have any significant chance of survival.
That's
That's
pretty amazing.
Yeah, and we've really made these investments not because it's hugely profitable, but because it's the right thing to do. We have the capabilities based on our other products to develop and manufacture these, and that's why we do this. The two products you mentioned, our pediatric heart valve was launched in the US in March of 2018, and it's the smallest mechanical valve and is really a breakthrough treatment for small and young patients who really don't have any other products available to support them. The other is the Piccolo device. The Piccolo device is an occluder that is used to treat minimally invasively premature babies who are born with a very low birth rate, but have a congenital defect called PDA, or patent ductus arteriosus. The Piccolo device is able to close that and allow those children to thrive.
And are these are pretty common ailments in children? I mean, do you have any idea how many of these are needed every year?
Yeah, so certainly whether it's the valve condition or the PDA condition, there is a small portion of the population that is born with either the valve condition or prematurely and at low birth weight who have the PDA condition. So again, it's not a huge market for us, but it's one that desperately is needed for the children with those conditions.
Literally saving lives. And when you say small, I just want to give people an idea. I wish we had one. I mean, you can't really fully appreciate the photo in the magazine because it looks larger than. I mean, it's just teeny, tiny. Can you help people understand? Because the thought of manufacturing something that at that level is just kind of mind-blowing.
Yeah, so both of these devices are incredibly small. So the mechanical heart valve is about the size of a dime. So if you can imagine the diameter of a dime, that's the size of the valve. And then the Piccolo device is even tinier. It's smaller than P. So it's very, very tiny. And it needs to be to treat the patients who many times are under 2 pounds in weight.
Yeah. Can you talk a little bit about the process of making these devices? I mean, you make them, you manufacture them right here in Minnesota?
We do, yep. So the Piccolo device is, it's a self-expanding wire mesh device that physicians insert through a blood vessel in the patient's leg and guide it to the heart where it will perform the treatment. It's made of a nitinol material, so It's a shape memory alloy, so we're able to manufacture it, and then when it's deployed, it can shrink down to a very small diameter, but open up to the size needed to treat the patient.
Wow. I'm also curious just about the history of these sorts of devices and heart treatments in particular in Minnesota. Why do we seem to have such a rich history in this area of medical devices?
Yeah, so I'll start with the mechanical heart valve. That was started here in Minnesota, designed, developed, and initial manufacturing here in Minnesota over 40 years ago. And it's continued to evolve, initially focused obviously on larger patients. But what we've been able to do is apply that same technology to shrink down the size of the device so that we're able to treat these very small, very young patients. Likewise, the Piccolo device was developed here in Minnesota and built on over 20 years of history with our Amplatzer product line. So there again, taking the knowledge and history of designing and developing these products, the team was able to shrink that down, as I said, to smaller than a pea, in order to treat these very young patients.
Amazing. So, I mean, it really is an opportunity for Minnesota to sort of own this segment of the market.
Absolutely.
So talk a little bit just about you've been in this field for a while now, you know a thing or two. What evolution have you seen in whether it's materials or technology or innovation? Where do you see the most, creativity and innovation happening in the field and maybe in heart valves in particular?
Yeah. You touched on it, and that is, we've continued to see materials evolve, and what the materials are able to allow us to do is to shrink down many of the components that go into our devices, which is obviously needed for the two devices we mentioned here, but also in other products as well. So with these new materials, there's new types of processing that's needed. So whether it's different types of polymer processing used to make different tubes or fabrics, whether it's advancements in CNC machining or micro machining as well, laser processing, both cutting and fusing and machining of products has continued to advance and allowed us to progress there, as well as traditional molding of components and newer processes like additive material processing. Those, from a material and process standpoint, have been very key. Other advancements that are kind of helping us in manufacturing, as they are in many other industries, is automation and the processing of data. We generate huge amounts of data in our manufacturing plants, and what our systems are able to do now is take that data and convert it into meaningful information for our manufacturing teams to provide them quicker response or greater insight to what's actually happening in the factory to allow us to continue to drive out waste and reduce variability in our processes.
Amazing. I just want to remind everybody, if you have a question for Brad about manufacturing, about medical devices, about heart valves, feel free to post it while we still have a few minutes. Brad, I'd be remiss if I didn't state the obvious, which is the reason why we are Zooming today rather than doing this in person, and that is we're in the midst of a global pandemic. How, if at all, has that impacted your manufacturing and the way you're working at Abbott?
Yeah, so the manufacturer of our products is deemed an essential business. So we have continued to manufacture through the pandemic, but it's very it's a very different environment for the people who are going into the plant day in and day out to manufacture life-saving products. We're following, all of the guidance that is put in place locally, and what that means for employees is, we're now wearing masks in the buildings. We have greater distancing between employees. We have the clear barriers around workstations where possible to enhance that distancing. Everybody's getting their temperature checked as they walk in the building every day. So much of the same activities that we all experience when we're going, shopping or to the doctor's office, we've had in place for several months now, actually, within our manufacturing facilities. So we're doing all of that, again, just to ensure the safety of our employees who are traveling to the plant every day.
Of course, and you're managing this whole global operation from home.
Exactly.
It's amazing what we can do. Thank goodness for technology. Well, I want to ask you one last question about innovation in manufacturing, but before we do that, let's hear from one more of our sponsors.
To the honorees and finalists, congratulations. ProStaff is honored to celebrate this achievement with you, and we're proud to support manufacturing in Minnesota. Thank you and your teams for all that you do. Once again, congratulations.
Before we let you go, Brad, I just want to ask you what I think right now we can all use bits of hope and optimism for the future. What excites you about the work you're doing and about innovation in medical devices?
Yeah, we talk a lot about the technology and the advancements in processing and materials and systems, and how everything is so becoming more and more high tech. But one thing, amidst all these advancements that remains constant is our need for human talent to perform, many of these complex operations that expensive equipment and automation just cannot do. So we've continued to, hire and train employees to perform these jobs that are essential to everything that we've just talked about.
Well, that's great. It's good to know that there is still a place for humans in the mix.
Absolutely.
With all the innovation. Well, thank you, Brad. Thanks to Abbott, and congrats on the recognition. We're thrilled to have you in the magazine and be highlighting the great work that you're doing. I just want to thank everybody for joining us today. And I also want to once again thank our sponsors, PNC Bank, ProStaff, and Ware Technology Services, as well as our industry partners, the Minnesota Precision Manufacturing Association and the Manufacturers Alliance. Thank you all for joining us. We hope you'll tune in next Tuesday to hear from Bob Waldron, CEO of Cameron's Coffee. Very different than heart valves. We're switching gears, that's for sure. We will have this and all the other webinars online, so check back there at tcbmag.com. Thanks again, everybody, and have a great day.